Dear students, today we'll be learning about the organization of the vascular system of the body. This video is made for the students who have just started their med school and they are just learning the basic concepts. So for that reason, we are displaying this whole human body in front of you from head to toe. And then we'll take one by one how the arteries and the veins has been organized within this model. So I'll be starting from the arterial system first. So when we talk about the arterial system, we have to take in consideration the first structure, that is the heart. And heart, we all know it's a pump. And there you are looking at the heart and its different chambers. But what you can see, out of this left ventricle of the heart, we have the emergence of this aorta. And the first part of this aorta is called ascending aorta, and then it becomes arch. And that is the arch of aorta, and then it starts its descent. And when it's descending, we call it descending aorta, and it goes behind the heart. It runs in the posterior mediastinum, and you can see in the rest of the thoracic cavity, it is being overshadowed by this heart. And then you can see the structure here, that is the diaphragm. It passes through the diaphragm, it enters the abdominal cavity, and it goes all the way till my fourth lumbar vertebrae, where it bifurcates into two common iliacs. And these common iliacs, they further divide into internal iliacs and external iliacs. Internal iliacs are the arteries for the pelvic cavity, and the external iliacs are descending down to supply my lower extremities. Okay, so coming back to the arch of aorta, what we can see, this arch of aorta give three major branches. One major branch on the right side, we call it right brachiocephalic trunk. Then we have in the middle left common carotid, and then we have left subclavian. Now we need to understand what are these three major arteries which emerge from this arch of aorta. So on the right side from the aorta, we have right brachiocephalic artery, which bifurcates into right common carotid and right subclavian. Right subclavian is meant to supply the structure in the thoracic cavity, as well as primarily it's going to be distributed within my upper limb. So if we can track it down, the right side, you can see that it reaches to the axilla. We call it here as axillary artery. It becomes brachial artery. It's towards the thumb, we call it radial artery. Towards the little finger, pinky, we call it ulnar artery, and then it ends up in the hand, palm, where it ends up into superficial and deep palmar arches. Okay, so if we come back on the left side, we can see on the left side we have two, and this is my left common carotid. It goes also to the neck, and it's responsible, like right common carotid, responsible to supply the structures which are present within the neck and the head region. We'll not be talking today about them. And then you can see the left subclavian artery, it is doing the same what right subclavian artery does. So subclavian artery, after supplying the thoracic cavity, it enters in my upper limb. It changes its name. It's called axillary artery when it is located in the axilla. When it reaches to the arm, it is called brachial artery, because that's a brachial region. When it goes to my forearm, that is antebrachium. So we divide it into radial and ulnar arteries, which ends up terminating into superficial and deep palmar arches. We'll be learning in MSK block in detail about that. Now going back to the abdominal aorta. In the thoracic cavity, I cannot show you the branches because everything is being overshadowed by these mediastinal structures. Let's talk about the abdominal aorta and its branches in the abdominal cavity. But first, you can see different organs which are located in different locations. On the right side, under this diaphragm, you can see a liver. On the left side, you can see the spleen. And then on the parallel to the abdominal aorta, you can see on both the sides these two brownish ovoid organs. These are the kidneys. So these are the organs which are visible in this model. So this aorta gives so many branches in the abdominal cavity, and we categorize them under different coverings, and those will be learned when we'll be learning about posterior abdominal wall and its structure. But worth mentioning, it gives three main branches, which are primarily, the first branch is the celiac trunk, which is also known as the artery of the derivatives of foregut. And then we have superior mesenteric artery, which is the artery of midgut derivatives, and inferior mesenteric artery, which is the artery of hindgut derivatives. So these are three worth mentioning, and then you can see the renal arteries, which has been shown going to both of the kidneys. And then if you look downwards, you can see these two which are going downwards. They are basically, these are the gonadal arteries, and their job is to supply gonads. In males they are called testicular arteries, and in females they are called ovarian arteries. Okay, now let's look at the veins which are visible in this model. So I like to start from the bottom part, and there you can see these are two common iliac veins. They join to form inferior vena cava. On its way towards the heart, because its destiny is to reach to the right atrium of the heart, it receives so many tributaries. We don't call branches, we call tributaries. Arteries have branches and veins have tributaries. So it receives so many tributaries, and ultimately it ends up in the right atrium of the heart as inferior vena cava. And if you look at superiorly, so there you can see from the left side and from the right side two internal jugular veins. After joining the subclavian on the left side and subclavian on the right side, they make brachiocephalic veins. And these two brachiocephalic veins, they meet to form superior vena cava, and this superior vena cava, it also receives other tributaries, and ultimately its destiny is also to reach to the right atrium of the heart. So all the veins have to come to the right atrium of the heart.